Dehydration kills more children aged 5 and under than the combined total of AIDS, malaria, and tuberculosis. A properly formulated oral rehydration solution is one of the most important medical advances in modern medicine. I was first here on January 15th, 3 days after the earthquake. I came back with Melissa Russler under the auspices of Doctors Outreach Clinics and DripDrop to promote oral rehydration therapy.
This is Caribbean Market, the biggest supermarket in Haiti. When the quake hit, it had a lot of people in it because it was 5 o'clock, which is the time where most people come by and start shopping. I had a lot of friends who were able to escape, close friends, but lost a lot of friends here.
I'm still in the street, living the street, because I ain't got no house. I make like a little small house for 4 of us, me and my 3 kids and my girl. I don't live comfortable, but God help us anyway. We still live.
The leading problem in any disaster area from a healthcare perspective is dehydration, the #1 killer of children 5 and under.
I am Alison Thompson. I am the medical director of the camp. We run 5 clinics and a hospital. We see about 3,000 patients a day. The most important thing coming in is children and babies with diarrhea and fever and everything. People are dropping in the lines, and sometimes we have 100 people dehydrated in our MASH unit. We get lots of shipments of everything. This is the most important thing needed in Haiti right now.
3.5 years ago, I began to develop an advanced oral rehydration solution. Our DripDrop that not only was medically relevant, but also tasted good. One of the major barriers to its implementation in the real world.
Like Sierra Mora, but tastes much better.
Dehydration is rampant, and with the heat coming, June and July are the hottest months. Hurricane season, the water, the rains, there's going to be a lot more incidents of diarrhea, dysentery, cholera. So we feel that there's an urgent need for us to get a program in place.
We introduced DripDrop into the refugee camps, the orphanages, hospitals, clinics, in an attempt to save lives. I am in the rural outskirts of Port-au-Prince in the valley, which is very hot and dry. We have seen today about 350 patients and dozens of cases of diarrhea and dehydration due to diarrhea. We've been rehydrating with DripDrop, which has been very well received by the Puerto Rican team. They've seen a lot of good results already.
Dehydration is a very big problem here in Haiti. This specific patient that I saw, he was 4 months old and he hasn't eaten anything since last Monday. Basically, he wasn't eating, he wasn't going to the bathroom. He was very lethargic, he was dehydrated, and then as soon as the mom started giving him the medication, he started sucking like no problem. And you can tell that he liked it, and he drank half the bottle that we gave him in like about half an hour, 45 minutes, and he was crying, he was moving around, he was very active afterwards, had a diaper change, so we were very happy.
I think the most impact for me was witnessing firsthand the life-saving capabilities of oral hydration therapy. I've read about it, learned about it, but to witness it firsthand in practice really brought affirmation to our mission to bring this proven medical intervention to the world.
I think that any attempt to treat dehydration has to be two-pronged. On one side, you have to have a product, and on the other, you need to have an educational initiative. Anytime we dispense DripDrop, we educate the moms on how to make oral rehydration solutions using local substances, salt, sugar, and clean water. The hope behind DripDrop is that we can not only save lives, but also decrease suffering. We believe that by educating doctors, nurses, pharmacists, dietitians, moms and dads, we can prevent deaths due to dehydration.